Let's talk about lip care and transitioning from the winter to the summer. Hi, welcome back to Face It with Dr. G. I'm Dr. G. Welcome to the channel. Like, subscribe, comment. Happy to have you guys. Let's talk about lips today, lip care. Let's talk about transitioning from the winter to the summer. What do we do? Do we wear SPF? Let's talk about all the things. What are some of the biggest issues that affect our lips, especially after the cold, long winter if you live in a northern climate? And what about from wearing masks? Things we experience are things like dehydration. You have the cold air that takes the moisture out of your lips during the winter. You can get chapped lips, which is also known as cheilitis. You can then get irritation, and medications can also cause dryness, such as antihistamines and chemotherapy drugs. During the spring, when you have all the blooming flowers and you have allergies, you take antihistamines, you may notice that your lips are chapped. Topical acne medications, such as retinols as well as Accutane, can cause dryness of the lips. So why do our lips dry and crack when it's cold outside? The skin of the lips is very thin, some of the thinnest of our bodies. They don't have their own oil glands, the sebaceous glands, so they're not able to produce their own moisture. So whatever moisture we get comes from our diet and from what we put on our lips. Weather is the most common cause of dryness of the lips. The dry air actually draws moisture from the skin. This causes dryness and cracking. Then we lick our lips, so we have saliva on our lips to moisturize them, which in turn worsens the cycle because that saliva evaporates, and as it evaporates, it takes additional moisture with it. There is the vicious cycle, and we continue to lick and lick and lick, so let's try and stop that. Is hydration important? What are ingredients to avoid? What are ingredients to look for? The most important thing I want to stress is sunscreen, and we put sunscreen on our face, we should every single day, 365 days a year, our ears, our neck, and don't forget your lips. Your lips are really important, so sunscreen is a must. Helpful ingredients for your lips include emollients and hydrators, such as petrolatum, lanolin, which you want to be careful if you have an allergy to lanolin, be aware, beeswax, and ceramides, which are fatty components that really help building blocks of our cells and keep moisture inside the cells. They build the fatty acids of our cells. Natural ingredients that are incredibly soothing include aloe, which is an antioxidant, anti-inflammatory, coconut oil, honey, which is also an antioxidant, also has antibacterial properties, cucumber, green tea, and both of these have antioxidant and anti-inflammatory properties. They're all very soothing. Avoid products with drying alcohols, such as simple alcohols like ethyl alcohol and SD alcohol. These can cause dehydration and loss of moisture from the skin cells and irritation and cracking. Other ingredients to avoid, ingredients like menthol, camphor, mint. These can be very drying. Scents can also cause dryness, fragrance. So those are some good key points. Also, one thing, avoid smoking. Smoking isn't good for any of us. It's not good for your lungs, it's not good for your body, it's not good for your skin, it's good for nothing. Okay, good. What about exfoliation? Do we need to exfoliate our lips? Is it necessary? And what products and what types of ingredients do we look for? Exfoliation, in my opinion, this is only my opinion, this isn't professional medical advice here on YouTube, but exfoliation is not necessary. However, doing this once or twice a week can help remove any excess dead skin that's affecting absorption of other products that are applied to the lips. Don't overdo it and be gentle. Another thing that can be helpful to put in your home or in your room is a humidifier to help increase the moisture content in the air. Lip masks. Do you guys use lip masks? What do they do? How often should we use them? Again, lip masks are a topical treatment that can help hydrate. Be sure that the ingredients don't include any drying alcohols that will further strip your cells of moisture. Make sure they have aloe and other really rich nutrients, and using them once or twice a week can't be harmful. Let's talk about lip cancers as we get into the summer, and now we're in May, which is Skin Cancer Awareness Month. So lip cancers are rare on the spectrum of cancers. It's about 1 to 2% of all cancers. 25% of oral cavity cancers are lip cancers. They're more common in men than women, usually in Caucasian men. Squamous cell carcinoma is the most common. You can find basal cell carcinomas as well. Squamous cells usually involve the red part of the lip, and basal cells usually involve the white part of the lip. Basal cells usually don't involve lymph node metastases. Squamous cells can. Rarely you can get cancers of the salivary glands, which are adenocarcinomas, and you can also have melanomas and sarcomas and lymphomas, which are also very rare in the lips. Which lip do you think is more affected? It's actually the lower lip. So the lower lip usually protrudes a little bit more from your face and can be more affected by UV rays. So therefore, skin cancer is more common there. Lip cancer can present as multiple clinical lesions. It can be either a flat ulcerated sore, a papule, a flaky lesion that doesn't heal. It can ulcerate, it can scale, it can be white, known as leukoplakia, or it can be red, which is known as erythroplakia. Leukoplakia is a nonspecific term. You want to rule out an infection, and it's not always linked to a precancerous or cancerous lesion. Erythroplakia more likely is associated with a precancerous or cancerous lesion, and you can also have overlap, which is called leukoerythroplakia. I recommend, if you have any lesions that you're concerned about, make an appointment with your board-certified dermatologist to take a look. Let's see. You can also have some numbness, tingling, some other side effects with these lesions. The biggest thing, if you notice any changes, go ahead and get them checked out. I hope that helped. Let's talk about a couple other things. Lip plumping products, do they work? I think they do work. Let's talk about ingredients so you feel educated that you can make the best decision when it comes to a lip plumping product. The Soy Air Skin Collection, which is my line that I've developed, has an incredible lip polish called Levris Pure. It's a precision lip polish that plumps, it hydrates, it stimulates collagen, and it has SPF. Some ingredients that you should look for are sodium hyaluronate, the hydrolyzed form, which is a smaller variant of hyaluronic acid, ceramides, herbals, vitamins, conditioners, and niacinamide. Those are some amazing ingredients that are all in my lip polish and many others. So hopefully you can go out and take a look, plump those lips for the summer, and have fun. I hope you guys enjoyed this. Like, subscribe, comment below. Let me know your thoughts, and I hope to see you again next time.